And I think with a point of care, if hospitals are able to do it themselves, that would really be beneficial. It's also, of course, that's close to the home of the patient, so the traveling will be much better if we do the point of care. My name is Jolanda de Vries, and I'm head of the Department of Medical Biosciences. I'm a professor in immunology working at the Radboud University Medical Center in Nijmegen, the Netherlands. So I'm working really close to the clinic, but I am in a preclinical department.
So what's your relationship with Miltenyi Biotech?
In 1989, I had an internship and I wanted to isolate eosinophils. And that was not that easy. So then we had an antibody and we wanted beads to coupled. And then we called Miltenyi to find out if they could do it for us. And then we learned they could do it. Then afterwards, I became a postdoc and a PI, and then we worked on dendritic cells, and we isolated them with plastic adherents, but getting them into the clinic in a mode that you can use it also, that they're stable and that you can have a constant product. We also needed the beads again, so then we went back to Miltenyi and we asked them to help us with the isolation, first on the Clinimax and afterwards on the Prodigy. So we are working already together for a long time.
So here we talk a lot about how cell and gene therapies could transform the treatment landscape for solid tumors. But of course there are challenges, right? So what do you encounter when you're trying to provide effective therapies to your patients?
Now, it's always challenging because cell and gene therapies are not cheap. So for me at the moment, it's more about the prevention. Patients with cancer already have large tumors and have an immune system that's really suppressed. So it's for us the challenge now to get an immune response going. So we really want to do this in a preventive setting. And I think that the immune system is really capable of preventing the cancer to occur. So that is now my goal for the next trials. So we will start the phase 3 trial in about a year. And then we will try to really show that we can prevent cancer in patients with Lynch syndrome. These are patients that have a high probability of getting cancer at a very young age. And if you can prevent that with using dendritic cells and increasing an immune response to precursors of the tumor cells, that would really help.
And when looking at the bigger picture, what do you see as the biggest barrier in the adoption of cell and gene therapies in mainstream medicine?
At the moment I see the biggest hurdle is regulatory, and that's very difficult to get marketing authorization for ATMPs.
How does the point of care and Clinimax Prodigy platform help you or support you to bring down these barriers?
Now, of course, if we think about hospital exemption, then in the Netherlands we are only allowed to do 50 procedures per year. So if we have multiple hospitals participating, then we could treat quite a lot of patients. And I think with a point of care, if hospitals are able to do it themselves, that would really be beneficial. It's also, of course, that's close to the home of the patient, so the traveling will be much better if we do the point of care.
So when looking at the future, what's your vision? What does the future for patients look like with cell and gene therapies? What do you think?
I think that for patients it's a great opportunity. Most of the time it's autologous, so it's from the patient him or herself, and that's really helpful to combat the cancer. And maybe not only for cancer patients, but also for other kinds of patients with autoimmunity. Yeah, I think it's especially important for the patient himself. If we do an apheresis in the hospital, you don't want to ship the apheresis to a completely different hospital. So it would be really great if we could do that at site immediately. And often the procedures done at the apheresis department, the hematology department, are quite close to where you can do the point of care. So it would be, the quality of the project will be much better if you do it immediately on site. And furthermore, the timelines is also very important for my team to produce the cellular product. It is at least 12 hours, so it would be nice if it's not first has to come from one hospital to the other and that they can start later. So that's really beneficial. And now we are also trying to get a full package. So that is not only the isolation, but also having the right analytics to do the release of the product. So I think it's very important to get this in one package so that it's from start to end all in one go, and that you only have to do this once and that it's all regulated together. We are just starting with the point of care, so now I hope to hear that we can really learn from other people how they proceeded and how they did it. That will be really great to see. And of course also meeting other people also gives you the opportunity to talk to them in person, and in that way you learn even more than only during the presentations.